evening. My name is Adetokunbo Igbatayo. My presentation for this evening is liver disease. But before I start my presentation, these are the couple of things I'm going to define in my presentation. Number one, we got to talk about the liver itself, the function, the etiology, pathophysiology, clinical manifestation, complication, treatment, and nursing consideration. So, what is liver itself? Liver disease is an organ about the size of the football. It sits just under the rib cage on the right side of your abdomen. The liver is essential for digestion, food, and getting rid of your body of toxic substance. Here are the function of liver. The liver itself. Number one, what does the liver do to the body? It helps in digestion, fat metabolism by breaking down of fat, breaking down of metabolism. What does protein do to the body? Is to build up the body. What about carbohydrate? The liver helps in breaking down of carbohydrates that is called glucogenesis. That glucogenesis is used for the reservation of energy. I mean, when the time comes for to use the energy, the liver will release the carbohydrate itself. Detoxification. Liver helps in getting rid of dirty substances from the system. And also the liver stores vitamin A, D, B12, and also carbon, iron and carbon. So what does it mean etiology? Etiology means the cause of the liver disease. The most common cause of liver disease are chronic inflammation, alcohol use disorder, too much of alcohol leads to cirrhosis. Medication. I was told that there's some medication. I'm not sure what is the name of this medication for. Is it Aleve? Some of the medication are dangerous to the liver. And obesity, including genetics. Some family member they have this genetics disorder called liver disease. The pathophysiology. Chronic liver disease refers to a long-term pathophysical process of continuous destruction of the liver. And this when the liver keep breaking down, keep destroying, it affects the liver from metabolize nutrients to the body. The function of the liver are wide-ranging and including selling of clotting factors and metabolics of drugs and ghrelin. Symptoms of liver inability to perform this function. What are the clinical manifestations? The signs of this liver disease. Let me say to the back. Let me take you back. The reason why I did this presentation is that I lost one of my employees due to this liver disease, and I also saw some of the signs on him. That was the reason why I presented this topic. So the clinical manifestations are yellow eyes, skin. The eyes are yellow. Then also the skin, known as jaundice. The loss of appetite. The patient will not be able to eat. Nausea, abdominal pain, swelling, and swelling of the legs, including dark urine. See, I have some more here. Complication of the disease. What are the causes of if this liver is not treated or if maybe the patient did not go to the hospital or did not see the doctor. These are the complications. The complications of the liver disease are various, depend on the cause of the liver, depend on the liver problem. However, untreated liver disease may progress to liver failure, damage, and a life-threatening condition. Treatment. What are the treatments? Treatment. We have medication, lifestyle changes such as losing weight, avoid alcoholic limit, fat in diet, increase fiber intake. Liver transplant. No, people do liver transplant when the liver is beyond when the liver is something that you have to, when the liver is not performing the rightful function, so people have to do liver transplant. Liver transplant, when the liver disease progress to liver failure, yes, a liver transplant may be the best treatment option. A transplant replaces your liver with a healthy liver. What are the nurse's consideration of disorder? Number one, the nurse has to check for infection of the patient if the patient has infection. Number two, bleeding. Number three, nurses have to monitor for patient for signs of hypovolemia. That is when the plasma in the blood is too low. It can lead to shock. Test for stool, and then you have to check for vomit if the patient has a blood in the vomit. Then the patient has to rest. Providing adequate nutrition, skincare. And lastly, I have a quotation here which says, life is a long lesson in humanity. Taking care of yourself is the best option to avoid problem. Thank you. What are the risk factors of liver disease? Number one, alcoholic abuse, using too much of alcohol. Two, gastric bypass surgery, high cholesterol. There's too much cholesterol in the body. Is high risk of liver disease. Malnutrition. When patients are not getting enough nutrients in the body, it's prone to liver disease. Obesity. For a male, when the BMI is more than 30, is not good. That is what we call obesity. Okay. Obesity. Then weight loss, too much of weight. When you're losing weight rapidly, that also prone to liver disease. Then too much iron in the body. That is out of it. It's not good. So all these are the risk factors of liver disease. Like I said here, life is a long lesson in humanity. Taking care of yourself is the best to avoid problems. Okay.